How to know the warning signs that could indicate schizophrenia in a loved one? Schizophrenia is considered a serious mental health condition that affects a person's ability to think, feel, and act normally. It can be difficult to identify if someone is suffering from schizophrenia, as the symptoms can vary greatly from person to person. Knowing what questions to ask can help determine whether your loved one has schizophrenia. Here are these important questions. Question number 1. Does your loved one struggle with maintaining relationships? People with schizophrenia often struggle to interact with others due to their condition. This could be because they are unable to focus on conversations or maintain meaningful relationships. They may also isolate themselves from family and friends for reasons that are hard to explain fully. Question number 2. Does your loved one hear voices or suffer from delusions? Hallucinations and delusions are common symptoms of schizophrenia. Delusions are beliefs that are not based on reality, such as the belief that they are being persecuted or followed. They can range from mild experiences, like hearing voices in their head, to more severe forms, such as feeling like they are being watched. Question number 3. Have your loved one experienced a change in their sleeping habits? People with schizophrenia often experience changes in their sleep patterns. This may include too much or not being able to sleep at all, which can lead to fatigue and depression over time if left untreated. Question number 4. Have there been any sudden changes in behavior? Are they experiencing mood swings or emotional outbursts that seem out of proportion to the situation? Sudden changes such as aggressiveness, disorientation, confusion, agitation, social withdrawal, and paranoia. This may include sudden outbursts of anger and cry for no apparent reason. Question number 5. Have your loved one expressed thoughts of suicide? This may include talking about suicide or engaging in risky behavior. This is an important question to ask when determining if someone is suffering from a mental illness such as schizophrenia, as those living with this condition often experience suicidal ideation due to the severity of their symptoms. Question number 6. Are they having difficulty organizing their thoughts or speaking coherently? This may include speaking in a way that is difficult to understand or jumping from topic to topic. They display unusual body language such as making sudden facial expressions or speaking in a monotone voice without any emotion behind it for long periods. Question number 7. Does your loved one have any self-destructive tendencies? Self-destructive tendencies could include drinking excessively, using drugs or other substances such as alcohol, engaging in risky behaviors such as driving recklessly, or even self-harming such as cutting themselves, etc. All these behaviors should be taken seriously and evaluated further so proper treatment can be provided. Question number 8. Have they experienced a decline in their personal hygiene or self-care? This may include not showering or brushing their teeth regularly. Question number 9. Does your loved one have difficulty concentrating on tasks? People suffering from schizophrenia often experience difficulty focusing and may become easily distracted. This symptom may manifest as having trouble following directions, forgetting things easily, completing assignments, or finishing conversations. Question number 10. Are there any physical signs that point toward an underlying issue? Physical signs, such as difficulty speaking clearly or slurring words, along with poor coordination when walking, running, and performing everyday tasks. Question number 11. Is there any history of mental illness within the family? If there is a history of mental illness within the family, then it is likely that the individual has inherited some genetic traits associated with conditions such as schizophrenia. If you recognize any of these warning signs in a loved one, it's important not to ignore them but seek qualified healthcare professional help immediately so they can receive the care and treatment they need before things get worse. While it's impossible to diagnose someone definitively without consulting trained medical professionals, asking these 10 questions will provide valuable insight into whether your loved one may need additional assistance managing their condition effectively going forward. Remember, early diagnosis means earlier access to treatment options. So don't wait until it's too late. If you want to discover more about yourself, please subscribe, like, share and hit the bell icon.